Hi, my name is Alexandra Bream and I'm a market analyst at Signify Research. Welcome back to our Women in STEM Week. Today I'm joined with Senior Market Analyst Imogen Fitt, who is also my manager and mentor. So Imogen, what does being a woman in STEM in the health tech industry mean to you?
It means being conscious of the example that I set and the support I provide to others. There's plenty of women that I've encountered through my role as an analyst in both the digital pathology market but also other health tech markets that are very, very capable, but there's always room for many more.
What attracted you to the healthcare tech industry specifically?
So I loved learning about science, but I loved communicating what I'd learned more. And at Signify Research, I've had the opportunity to engage with stakeholders in major organisations and help make decisions that directly impact healthcare markets. So the content I produce is read not just by vendors, but also some clinicians. Healthcare, I think, is a subject which impacts us all at some point in our lives, so it's very rewarding to be in this field, I think.
And what challenges have you faced navigating through the industry?
So I've conducted analyses over quite a few different kinds of health tech markets, which has meant that time and time again I've had to get into new situations and introduce myself to a lot of new people. That can be challenging in terms of having to adapt quickly and putting yourself out there and being aggressive enough to make a good impression the first time. I've learned a lot, and I've learned how to quickly establish my expertise and stand my ground when I'm making these recommendations. That's especially fulfilling when I'm right.
Yeah, I can imagine that would be tough. And what advice would you give to your younger self or someone younger entering the industry?
So I suspect this is going to be a common theme, but establishing self-belief early on is quite important. Getting yourself out there and not being afraid to make mistakes, especially early on in your career when they're not going to have a lasting impact, it enables you to be more proactive and essentially put yourself forward a lot more. It's your job to introduce yourself to new people and to set an example and to lead in that sort of way. I guess what I'd like to do next time, had I the chance to do it over again, is just be more confident, essentially, in the value that I provide.
That's great, thank you. And what are you working on now that excites you?
Work in general excites me, that's why I do this job. I love learning about digital pathology, I love learning about the use of clinical data and real-world data projects, and generally just how healthcare is evolving. So my next study is going to focus on how precision medicine is being driven by different technologies across healthcare. So that's enabling me to look at things like digital twins or generative AI and how that's expected to impact everyday practice. The science is fascinating, but the reports I write will also help inform executives at top healthcare companies and will directly have an impact on how they invest. So that's quite exciting. I am also a manager now, which is great as I get to mentor somebody and essentially help her navigate her way through the health tech market as a woman in STEM.
I'm also looking forward to getting into more of the digital precision medicine area. Thank you, Imogen, for sitting with me today and answering those questions. It's been really great to hear your insights. If you would like to hear more about Imogen's work, please go to our website, where you can follow and connect with Imogen on LinkedIn.